We thought to ourselves, well, hold on, what if we actually asked a brain surgeon what he would do with a gigabit network in which he didn't actually always have to be in the same place at the same time. And we went to the department chair of neurological surgery here at Case Western Reserve at the School of Medicine here, and we said to Dr. Warren Selman, Warren, we have an idea of using this network infrastructure to do amazing things. As the former national chair of the American Neurological Society, what could we do to really make a difference in people's lives? And he and his colleague, Dr. Andrew Sloan from University Hospitals, are just about to share with you some really amazing work that they've been doing with a group of entrepreneurs here in Cleveland in a project that they're calling Surgical Theater, Pre-Living the Future. Please join me in welcoming Dr. Warren Selman. Warren.
Well, good evening. Thank you, Lev, for that great introduction. I appreciate that. As I said, my name is Warren Selman. I am a brain surgeon, and it is really my pleasure this evening to be able to share with you some very exciting news about a new project called the Collaborative Surgical Theater. Now, this project involves an academic institution, Case Western Reserve University, a healthcare provider, University Hospitals Neurological Institute, Department of Neurological Surgery, and a startup company, Surgical Theater, LLC, all located right here in Cleveland, Ohio. Surgical Theater was founded by an Israeli Air Force group of engineers who spent their career developing high-immersion, high-intensity flight simulators. Now, we are utilizing our shared experience to enhance clinical practice and improve surgical outcomes by taking some of that tame knowledge and taking it to technically demanding surgical procedures. The system we are presenting is coined Collaborative Theater. It uses the gigabit network to connect surgeons really anywhere in the country. Now, the Collaborative Theater provides a connected, dynamic, and interactive virtual surgery environment that is based, and what is unique about it is based on the patient's own specific anatomy as we define it every day by use of CT or MRI scans. The Collaborative Theater will allow surgeons, no matter where they are located, to, as Lev said, pre-live the future by being able to collaboratively rehearse and refine their techniques and share best practices for their cases. The procedure that you are watching is in the microsurgical clipping of a cerebral aneurysm in a patient who was treated just a few weeks ago. Now, the first session is performed by a surgeon who does not routinely do aneurysms. We'll call him the novice, clearly Andy Sloan. And you'll see that the novice chooses a straight clip to secure the aneurysm. Now, what you're seeing here is really the approach to the aneurysm as defined by really exactly what we saw at surgery, the patient's own anatomy, and you can see the novice trying to put the clip on the aneurysm, and really we'll find out that that's not the best way to do it. The important thing is that we're able to see this and rehearse this. Now, what you're going to see is that when a surgeon tries to put a clip on an aneurysm, there's literally hundreds of clips to choose from, and the important thing is to be able to try to get that clip placed in a very short period of time so that we can avoid a stroke. And that obviously is the whole key to this procedure. In this patient's case, what you're going to see is that by changing the angle of view very slightly and using a curved clip instead of a straight clip, a very subtle distinction but a very important one, we're able to secure the aneurysm and keep the vessels open. Now, during rehearsal, I can guide the surgeon for the optimal initial placement of the patient's head, for the optimal angle to look at, and as you can see, by using the curved clip, we're able to achieve exactly what we want to do. And thus, we're really able to rehearse this surgery just as if I were operating on the patient. It is the same view. I can see it, I can practice it, and I can teach others to do the same. So with the Collaborative Theater, the experts, the master surgeons, or the so-called top guns, can mentor those with less experience anywhere across the nation, providing really exceptional clinical outcomes enabled by super broadband connectivity. This is vitally important if we are about to and need to to decrease errors and improve outcomes. So what are we planning to do? Well, we're planning to utilize the collaborative theater to form a nationally connected health platform, allowing surgeons to collaboratively work together on surgical cases through real-time, simultaneous interaction on an accurate model of the patient's anatomy. This isn't just any anatomy. This is a patient's anatomy that they're going to see tomorrow. So surgeons from 2 remote sites can step into this collaborative theater and work together on a virtual patient case and jointly perform virtual surgery, allowing them, again, to pre-live the future. Now, such a practice is absolutely critical to success. As Matthew Syed said in his book, Bounce, on the science of success, purposeful practice is the only factor distinguishing the best from the rest. And again, this allows for purposeful practice. So we hope this short demonstration that you've seen now really conveys to you how very excited we are about the possibilities of the collaborative theater. I want to thank you for your attention, and please visit our website, www.surgicaltheater.net, to provide some more information on this exciting new project. Thank you.